We started the first Gianna Center in New York City about 10 years ago to offer the women of New York and Long Island a true alternative for their reproductive health. I learned about it initially because of my own faith, but as I learned about it and compared it to what women were being offered, I was really struck by the fact that I actually thought this was truly a better approach to women's health care. The Gianna approach, this natural procreative technology approach, is about using all of the tools of medicine to restore the natural fertility cycle. So we look at these symptoms as a sign of an underlying problem, and then we use a variety of tools to identify what are the contributing factors and then to correct them. Not only do they have their symptoms improve, but their health improves. For the Gianna centers, infertility is a symptom. There is a reason that a couple is having difficulty conceiving or is losing their pregnancies in the setting of recurrent miscarriages. And so when someone comes to us with infertility, we don't stop until we find the reason that it's happening. But for some underlying causes of infertility, our effectiveness rates are as high as 90%, and they gain the benefit of better health, natural conception, and actually better outcomes for their babies. The Gianna centers are not just fertility clinics. We actually treat the full spectrum of women's reproductive health problems: irregular cycles, polycystic ovarian syndrome, severely painful periods, severe PMS, ovarian cysts, even menopausal symptom management. We treat all of these problems using the same approach. We look at them as symptoms of underlying issues, and then we use our tools to identify the underlying cause. We use medicines which we're able to time very precisely to the woman's natural cycle because of the education that we empower her with to give her solutions that restore normal function to the cycle. If you are a woman who doesn't get a period every month, there's a reason, and somebody should be evaluating why that's happening, because the underlying reasons can have implications for your health. If you have severely painful periods, that is not normal. It's not just your lot in life as a woman, and somebody should figure out why it's happening, because it has implications for your health. People often ask me, do you have to be Catholic to come there? And the answer is, of course, no. By Catholic, we want people to know we are faithful to Catholic ethics, and that means we have a profound respect for the sanctity of life and a profound respect for the dignity of every person. It also means we have a profound respect for the ecology of a woman's body, and that's why we focus on restoring health and not just suppressing it. We have to make a very explicit decision that this is how we are going to care for people. We are going to take the time to listen to their symptoms. We're going to take them seriously and evaluate them. We're going to take the time to educate them about what's going on and then how to use the treatments we're recommending to get healthy again.